So I want to talk more about estrogen and fascia and pain and stiffness and all the things. So this particular article, the hormone receptor expression in human fascial tissue, I know that doesn't mean a lot to you, but this article is everything. If you're a woman who has fascia, which is probably you, like all of you that are following me, because guys generally don't follow me, unless it's my partner. Hi, well. So we know that estrogen and relaxin, which relaxin is not just when you're pregnant, play a key role in the inside of the fascia, which is your extracellular matrix, and it helps with remodeling, inflammation, all the things, okay? It even affects the stiffness of your fascia and affects the pain in the nerves. So you are more likely to feel pain in certain things. So in the introduction of this article, they are talking about that sex hormones affect connective tissues, but above all, ligaments. Tendons attach muscle to bone. Ligaments are bone to bone. Think SI joint or your pubic symphysis. So in this thing here, the arcuous tendinous fascia of the pelvis is this like fascial line, kind of think like linea alba of your belly, but it gets in your pelvis. It is compromised. Its tissue's tensile strength, meaning the stiffness. So as your hormones change, your line in that pelvis, the fascia in your pelvis softens and the strength becomes boop, 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 leading to pelvic organ prolapse, more urinary incontinence, because you lose the stiffness and the toughness that you need to keep your insides inside, because your vagina is a hole on your underside. And as those contents get loose, things can come down. And they're saying it's not just because you're wussy and you stopped using the muscles, it's because your tissues are changing. So they're saying they found sex receptors in the fascia of the pelvic floor, and that is why you could be leaking or having prolapse. They're stacking this on top of the information that you probably know in pop culture, that sex receptors have also been found in the human female ACL. So, young athletes are taught how to jump and how to strengthen, because we don't want these young women to tear their ACL. Specifically, we really don't want people who have EDS or connective tissue disorders or are really flexible to tear their ACL. The neat thing is, this article goes on to say, is that these hormonal receptors were not found in the pelvic floor muscles, just the fascia, okay? So it's pretty cool that your widespread joint pain sometimes is hormonally related because of all the things I talked about in the beginning. So you're not crazy. You just haven't been fully understood by science, and it's within you. It is your fascia. And this is why I talk about fascial fitness sometimes, because we need to take care of all of you. And it's more than just your muscles, and it's more than your bones. It's also your fascia. Technically, all of this matters, but I just want you to have knowledge, because